Hello, and many thanks for tuning in. I'm Darshan Osman. Cancer is characterized by uncontrolled cell proliferation, invading surrounding tissues and organs and spreading throughout the body. Now, over 100 cancer types exist so far, varying significantly in behavior and treatment response, hence requiring comprehensive, patient-centered care, emphasizing emotional support, empowerment, and also timely diagnosis. Now, effective communication with parents and families also ensures optimal treatment. This is why most healthcare facilities prioritize accessibility, comfort, innovative technologies, and also skilled staff. Now, to discuss further on cancer and what it entails, we have three guests joining us. But for now, we will be introducing two of them. First of all, we have Dr. Mohammed Yaqub Habibu, Head Radiotherapy, Department of NSIA Luth Cancer Center. And we also have Mr. Jesutomi Akomolafe, his Communication and Health Advocacy Manager, Trials of Color. Good evening, gentlemen, and thank you so much for joining us on one slot.
Good evening. Thanks for having me.
It's a pleasure to have you. All right, now let's begin with you, Dr. Yaqub Habibu. Now, first of all, speaking of cancer, it's on the rise in Nigeria, and it has become a concern for almost everyone. Once you hear the name cancer, there's this fear that actually grips you. So it's become a huge concern. Do you have an idea of the latest statistics on cancer prevalence locally, I mean in Nigeria, and how the rates have evolved over time?
Yes, there is an increase in the both incidence and the prevalence of cancer, especially in the low and middle income countries, of which Nigeria is also representing. And we know that more than 100,000 cancer cases are seen yearly in Nigeria.
Okay, so how has it evolved over time, from the first case in Nigeria, that's locally?
Okay, locally, we used to have more of cervical cancer than any other cancer in Nigeria. And we used to have very low rates of colon cancer. And cancer generally was not seen as a major problem in this part of the world. It was thought to be a disease of the developed world. However, over the years, the incidence has increased. And this is due to various factors. For example, we have better diagnostic equipment, so we are able to diagnose it better than before. There is more awareness, and then our lifestyle change also is towards the Western, style. So we are more sedentary. We are not. We don't live like we used to. We don't have the occupations we used to have. So because we are more sedentary and we are now taking Western diet, we also we are acquiring their type of disease. So cancer incidence is on the rise in this country.
All right, so let's hear from Mr. Akobolafe on, the huge concern that is cancer and, the fact that Dr. Yaqub Habibu has actually said that it's because we're tilting towards, Western diet and we live a more sedentary lifestyle. That is the major reason, for the spread of cancer.
Okay, thank you very much, Usman. I am a communication and health advocate. And there's something that must be made very clear based on those who have reached out to us. This cancer in Africa has been there for a very long time. But there's a problem in Africa, and that is problem of early detection. A lot of times, way back in those days, a lot of people died from diseases that none of them know what is the cause. Some of them believe it was a cause from the gods and many other stereotypes around it. But some of these diseases are actually liver problems and death from cancer. But because we have problems with data collection and gathering, and a lot of people do not visit the health center or to the hospital for tests and diagnosis, and they began to treat themselves with local herbs. So you see, the evolvement of the statistic we now have now, based on our own research, shows that because of the awareness, people are now coming out to get tested, and that's why we have the statistics that we have. I would not want to
So
believe
you're saying
that
it's not,
um,
we shouldn't say it is on the rise or it has evolved, but it's been there right from time. It's just,
it's
when it comes to
been there
diagnosis and
right
all
from
that.
time. Awareness brought it out. So when we say it dies from the Western world, I wouldn't want to absolutely agree with that. I lost a friend on Thursday to breast cancer. And do you know that
I'm so
after
sorry about
treatment,
that.
even while in, yeah, thank you very much. Even after treatment, while they're in remission, their cancer also comes back. Some of them, their cancer comes back after 10 years, after 15 years, after 18 years. We've lost 7 people and their cancer came back. So I wouldn't say it can be related to diet from the West. I would say it's more family history because there's a lot of time people do not know their family history of certain diseases that they are prone to. And as such, there's a high tendency that if the grandmother died from cancer at one point in time, or great grandmother died at one point in time, there's a tendency that one of them will have cancer over time, except if it is detected early. And that's why for breast cancer, in this part of Nigeria where you have breast cancer and cervical cancer for the female, for the male liver cancer and colorectal cancer for the male, it is very important that you get yourself checked as often as you can. And if you have a family history, this also puts you at a higher risk of getting cancer. And that's why Dr. Yakubu would agree with me. Now there are a lot of research going on into genetics to find out the genes, what's the issue, can we trace it to the gene, and a whole lot of things like that are beginning to take place in this side. So there's a huge problem, even up to this very moment. People still don't go for screening. When something is wrong with the body, it is most expected that you don't go to the pharmacy, you walk into the hospital to get checked, because in the process of you trying to self-medicate, you could get yourself into another problem. We have over 30 trillion cells in the body. If one cell begins to grow abnormally, there might likely be a problem, and then it becomes a tumor or it becomes cancerous from there. So there's a high tendency that one cell might, at one point in time, may just misbehave or something may just happen. But the bottom line of the numbers we are getting right now is because of the awareness in the rural areas, in your reserve population, to ensure that everybody are aware that this cancer is real. And if you have a family history or regardless of how you feel, get checked, get yourself checked. And these numbers will, of course, might keep increasing if people really don't get screened on time.
All right. Thank you, Mr. Komolafe, for that. And I'm being told that our other guest, our third guest, Professor Durosi Mieti, has joined us. Good evening, sir. Thank you for joining us on One Slot. Hello, Professor. Can you hear me?
Can you hear me?
Yes,
I can hear you.
I can hear you now. Thank you for joining us.
Yeah.
All right, let me bring the next question to you, and it has to do with vaccination, which a lot of people in Nigeria don't even know exists. Can vaccination eliminate cancer-causing infections? Are there challenges linked to, vaccination strategies in Nigeria?
Well, there are only a few sets of cancers that we can vaccinate against these days. And luckily for us in this part of the world, that one of them is cancer of the uterine cervix. That's the neck of the womb in every woman. It's a very common disease in this part of the world and indeed in many developing countries. So we do know now that if we give our children, especially female, you can also give male too. Don't let us think this is for male, for female alone. If you give the female children, when they are in the adolescent ages, from about 11 to about 14 years old, you can almost guarantee that they will not suffer from cancer of the cervix, which used to be a major killer, and is still a major killer in this part of the world. But in the developed countries, it is gradually being phased out. So that's the one I would think about that is relevant to our needs in Nigeria and indeed other parts of developing countries of the world.
Okay, so is that one of the challenge, being faced when it comes to vaccination? The fact that it's being phased out?
Yeah, that's one of the challenges, yes.
Okay.
Yeah.
All right, so let's hear from Dr. Yakub Habibu, on vaccination and the challenges, facing vaccination strategies and exercises in Nigeria. Hello, doctor, can you hear me?
Oh, sorry.
Okay, I can hear you now.
You can hear me now. Yeah. Just like Prof has rightly said, uh, cervical cancer is a major uh, cancer that can be reduced by vaccination of children. So adults could also be vaccinated, but after certain tests, that's women can also be vaccinated for after certain tests. And vaccination, like he rightly said, is not very popular amongst certain, population because of the attribution of vaccination to other illness and certain events that have occurred in the past, which education is needed to improve on awareness and benefits of vaccination. So with awareness and with increased knowledge, I think we can have more people vaccinated. And also, this part of the world, vaccination is not cheap. Vaccination, if we can make it cheaper, I think there will be more, intake for vaccination.
Okay, so just for the sake of, those who are watching and would love to know, do you have an idea of how much it costs to get vaccinated from some of these cancers, especially cervical cancer?
Yeah. Well, if you are to buy the vaccine from most private hospitals, I think it's up to about 40,000. I don't know the very current price, okay, but a few years ago, it's about 30,000. But I know that when some organization comes to do vaccination and they collaborate with companies that are ready to do corporate social responsibility, the price comes down. And I also know that the price is less when you do that in a teaching hospital.
Okay. All right, so let me come back to you, Professor Durosimieti. Now, and this has to do with, research advancements, on cancer. What groundbreaking, research and technological advancements hold promise, for improved cancer diagnosis, treatments, and also patient outcome?
Well, I would say the fact that we are now in the era of artificial intelligence, that's making quite a profound impact on the way we manage cancer from all aspects, from diagnosis to treatment itself. But let me just look at the middle part, that is the treatment aspect. Years ago, when I say years ago, I'm talking about 25, 30 years ago, even around the world. You want to treat a patient with cancer, even in the uterine cervix or the breast in the female. Incidentally, the cancer we see, they're mostly in the women and the breast and the cervix, which are in women, almost about half of the cases that we see. But the point I want to make is, in those days, you will have to try and do what you call treatment planning. Treatment planning for radiotherapy. That means you have to use the x-rays that you've taken. You can put in some body markers. Then you take these and put them on the table and map out the size of the tumor that is remaining after surgery, what you think is the residual lesion. And then you now try and transcribe this back and start doing what we call manual treatment planning. But gradually, with the evolution of modern technology, all these things are now being done, using computers. But more importantly, they are now even being done using artificial intelligence. So that what would have taken you about, say you want to plan a patient with breast cancer, for instance, ordinarily that will take you about 1 day, because you are doing what you call, you have to control the various lesions after taking all sorts of slides from your CT or what you call MRI, magnetic resonance imaging, or computerized tomography images. You need to identify all the structures that you want, and you identify them manually and circle them in what you call contouring. For the best practitioner, that can take quite a long time. Even an expert there spend about maybe 1.5 to 2 hours. But with the onset of artificial intelligence now, that can be reduced to about 5 minutes. And the beauty of that is that apart from you getting more time to look after our patients, we actually know that we get even increase in accuracy of the treatment of the patient that we are planning. The beautiful thing is, once you finish that and you decided that this is the plan I want to use, you can also feed this back into your computer. You can hear me, I hope?
Yes, yeah, go ahead.
Yeah, you put this back into your computer, and it also helps you to draw up the total plan, and then you can see them with your colleagues and you decide. Can even give you different, about 3 to 4 variants of that same plan, and you and your team, because treating cancer these days no longer one man's job. Yeah. You use a team to do that. You and your team, you can now decide, look, this is the best option. Let's all go for this. And then you decide, and then you treat your patient. And the outcome these days has been very, very, very,
So when you say team, you mean a specialized team, right? Because we'll definitely be getting to that.
Well, okay. But sometimes I forget I'm not talking to Dr. Yes, team. But with the team these days, look, you see, the cancer spectrum is quite wide, because we're looking at it from the angle of early diagnosis that people preach about, or which I also extend to what I call preemption, rather than even the early diagnosis. I say even preempting the cancer. That is to think, oh, this guy has a history, or the family has a history of cancer, whatever. Let's look at this fellow more. Let's do some more tests and pick this the risk of the exposure of developing cancer. So you can get those ones done, and once you can identify those at risk, you can quickly treat them. And then you go from that early diagnosis or preemption to early diagnosis, and then you come to treatment aspect, which is what I'm talking about now, which we have now found a good use for computers.
Okay, we will definitely be getting back to that, Professor Durosimi Eti. Now let's come back to you, Mr. Akomolafe, and let's talk about patient-centered care. Now, how can healthcare providers ensure, patient-centered care, guides to treatment decisions? Because, it's, when it comes to cancer, it's a very touchy disease. And I'm speaking about patient-centered care because I want to know how it addresses diverse patient needs. So how can we focus on that?
All right, thank you very much, Usman. And thank you, Professor, for your contribution towards that treatment option as well. In 2022, I lost one of my close friends to breast cancer after a tumor was removed. And according to the situation at that time, the doctors were on strike. And she was brought back to the house and was being treated home care from the house. She literally had bed sores till she died. But before she died, we did rush her back to the hospital. And they said, there's nothing we can do. There's nothing we can do. The doctors are on strike. Everyone is was shut down at this time. And that was how she passed away from that. She was brought back to Lagos, but at the time there was really nothing they could do. Now, the major problem with which we have seen with our medical system here when it comes to that aspect is aside, it's the incessant strike we sometimes have with our medical system, because we cannot say cancer is the major disease. There are other killer diseases than cancer. Of course, a whole lot of them like that. But sometimes we need to prioritize the medical practitioners who are there for the treatment, who are there in the rainy days. During COVID-19, we see them very, very spontaneous there. The government needs to pay more attention to their remuneration, to everything that has to do with them. Because when they are fine, when a patient needs the help, the person who gets it, the patient will receive adequate care. And when it comes to nurse navigation and the rest of them, if they are well taken care of, I strongly believe that if a patient walks in there, the person will get the necessary treatment that is required. We also have a problem currently which we face, which is the brain drain. We can also call it medical migration. You see a lot of doctors from the country leaving the shores of Nigeria for better pasture. And we do have well-trained medical personnel who are leaving. The question is that how many are left and how many are being trained to come out and remain in that system, so that when we have cases like this, the numbers of these cases are increasing every single day. The slum communities are literally not aware of these things. They don't have access to this treatment. In Irede and about 5 communities in that place called Snake Island, they only have one medical center that they all are relying on, and not even enough to provide diagnosis for cancer and the rest. We were there some time ago and we saw the state of things there. We did publish and wrote to the government to see a way they can come in there and rescue people. So the first thing that we must begin to also pay attention to is to be able to establish more access to care for everyone in rural areas, in communities that are not, they do not have this equipment.
Even if we don't have, even if we don't have them in rural areas, at least all the 36, states of the country, and also the Federal Capital Territory should actually have one. But if you take a look these days, you majorly find cancer care centers, in the FCT and in Lagos, and maybe one or two other places, and which is not enough.
That's true. That's true. You're right about that, and that's why we're preaching for more intervention in that regards.
All right, let's come back to you, Dr. Yakub Habibu. Now, can you tell us about some of the barriers that hinder timely diagnosis, staging, and also clear communication about, what cancer is and how it can be managed? Can you unmute your mic, please?
Sorry, thank you. One major barrier is awareness. There's gross lack of awareness in the community regards cancer. Another barrier is lack of equipment. Most facilities are not equipped to do diagnosis, and we have very few medical facilities for the population. And like the last speaker said, the Japa syndrome is also a terrible phenomenon that reduces manpower. There's lack of manpower too. Then finance. We have a dropping, financial, status for the populace. We are getting poorer and poorer as the naira is dropping. I'm talking of the average Nigerian now. So most of the time, if we are struggling to get 3 square meals, we don't think of screening, because if we do screen, the chances of getting diagnosis early is improved. And cancer is a disease that you can only cure if you detect at a very early stage. And also, even when you detect it at an early stage, finance becomes a barrier, because cancer is costly. We don't have good insurance that covers a good number of people. Only a few glitch has insurance, and this segment that has insurance are actually the wealthy ones that can do the treatment themselves, even if they didn't have insurance. So lack of insurance, lack of finance, lack of facility, lack of manpower, lack of awareness, all this put together hinder healthcare. for cancer patients. So if we can put in place structure, good structure that has equipment and manpower, if we can keep our specialists from migrating, and we can put the diagnosis on insurance, diagnosis and treatment on insurance, I think that will go a long way to break the barrier to improve to improve early diagnosis, and also to allow for appropriate treatment following diagnosis. And this will improve the outcome of treatment of our cancer patients.
Well, all right, doctor. Now, you did talk about, lack of finances being one of the barriers, that hinders timely diagnosis of cancer. Now, would you advise anyone to opt for traditional medicine when it comes to treatment of cancer?
Traditional medicine is not standardized. What a patient will see in Lagos as traditional medicine in different parts of Lagos will be different. And there is no verification of effectivity of traditional medicine. And the truth is that traditional medicine is not as cheap as we are thinking. Everything is on the rise, including traditional medicine. I would recommend that a patient that is diagnosed goes for orthodox treatment. I'm not saying that if they want to complement it with traditional, they should not, but the orthodox is proven. And I will prefer you go for what is standardized than to go for that is not standardized, because anybody can wake up and start doing traditional medicine. But for you to do the orthodox medicine, you would have passed through some process and some regulations and some standards before you can be an orthodox physician.
Okay. Well, thank you so much for that, Dr. Yakub Habibu. Gentlemen, we'll have to take a quick break. When we come back, we'll definitely continue this discussion. Please stay with us. Welcome back, and thank you for staying with us on One Slot. Now, if you're just joining us, we have been discussing cancer, an overview of cancer, its diagnosis, staging, communication, and preventative measures as well. And we have our guests still with us. We're talking about Dr. Yakub Habibu, Professor Durosi Mieti, and Mr. Akomolafe. Now, let's come to you, Professor Durosi Mieti. Now, still talking about diagnosis, staging, and communication, you did talk about, an advancement, in diagnosis, cancer diagnosis. Now, at the moment, what diagnostic advancements, have improved when it comes to timely diagnosis?
Well, it depends on what you are looking at. When you have a patient, depending on the site of the tumor. For instance, let's take a patient with cancer of the breast. You go from the diagnosis actually starts from the patient or the doctor noticing the lump, if there's a lump, and then which has to be biopsied. That is, biopsy means we take a little piece of that lump, and it's subjected to critical analysis under a microscope by our pathologists. And then when they do that, they do all sorts of other tests, which would actually end up giving that little piece of tissue they have from the breast, they'll be able to give it a name. This day and age, we are able to identify any type of tumor to its foundation. This is through this genomics studies and things. It's like having a child or anybody that you're giving them, okay, you are the son of Mr. A, your father is this, your grandfather is this, your mother is this, your great-grandmother is that. All those analyses are sort of technically possible in this modern day and age. And this is what we do when we ask patients to go for your biopsy. We ask for what we call immunohistochemistry analysis to tell you all sorts of different things, which means a lot to the doctors. And again, this brings up the question of when we're talking about having multidisciplinary mode for treating and managing cancer patients.
Mm.
Because you cannot do this alone. You have to do this along with the pathologist, with the surgeon, the pathologist, and then based on whatever information they give you, you now want to decide, okay, this patient should start with a surgery, and after surgery, you're going to have chemotherapy or immunotherapy. That's another recent thing that we do now.
Okay.
You know, we call targeted therapy.
Mm.
You know, this is why, because you know all the details about the tumor these days, and that goes for several tumors now. You know the details, and you know that, look, this tumor, this cancer, okay, I know the way it's going to spread. I know you not only spread through the blood vessels, you can spread directly to affect the other neighboring tissue or through the nerve root or any other route. But what you now do is that we are able to actually block the root. Whether, you know, there are so many things that so many things that we use to try and block and interrupt the progression of this tumor so that the patient ultimately becomes free, technically free of the tumor. And then the body on its own now, from its own immune system, can actually attack whatever is the residual tissue that is left within the body. All these are possible these days. And more and more on a daily basis, new research findings keep coming out that even for us as practitioners, you have to be up and about to be able to actually keep tab with the progress that's been made. And I think this is just good news to the human race as a whole.
Okay.
Now, Mr. Akomola sorry, earlier on did mention about limited facilities for cancer treatment. I'd like to quickly say, yeah, maybe that's in the past, although we haven't got enough in this day and age now, but the government, the last government and this present government and the government coming in the future, at least through, I'm talking about the Ministry of Health that we are concerned with now, a lot of efforts are now being made, being poured into making sure that facilities are available for treating cancer. At our own center, at the NSIA Youth Cancer Center, I know that's a center that is leading in cancer management in Nigeria, indeed West Africa, definitely, as of today. And we've done this, we've achieved now this, not only through government alone, but through private partnership proposal with NSIA and LUF. You know, you can still come together and join together, you know, get your talent, get your experts, get whatever you need, and together you can move forward. So with this approach, I know the government of the country has done so well that many other areas of the body, at least in each of the 6 geopolitical zones, we now have facilities, radiation therapy facilities, diagnostic laboratory facilities, and other things, even facilities for brachytherapy. This is what you use using radioactive material, which you place in direct contact with the tumor. You know, for tumor, like we said earlier on, the one in the cervix, or somebody that with tumor even in the lungs, or somebody with cancer in the esophagus, you know, or somebody with cancer in the prostate, or somebody with cancer in the tongue. These are areas that instead of cutting off the area, you can actually treat them brachytherapy. There's different modes of brachytherapy. You know, we can insert needles into them, and a huge dose of radiation is deposited. They kill all the cancer cells. But the beautiful thing is that these materials that you are using, they don't go deep beyond the area of interest. So the neighboring normal structures that are not offended, that are not offended us in any way. I mean, they don't concern the tumor cells. Yeah. They don't mean affected. The radiation does not go there, doesn't destroy this normal cell. So these are some of the newer techniques that we are getting on a daily basis. And more is being done in this regard. But perhaps I want to tie this before you go to your next question, whatever it is. Mr. Akomolafe also mentioned, no, I think it was Dr. Habib that mentioned the need, you know, for us to make sure that doing all these things without getting the manpower, you know, and the people well trained. And those people that are well trained, you don't do enough to keep them in this country. They go out because they are not even properly remunerated, they are not even properly taken care of. All sorts of things are going on. And at the end of the day, when people travel abroad, they still go end up seeing these Nigerian doctors. Yeah. I think we need to emphasize this aspect so that at least we can move forward in Nigeria. We are moving forward within the zone, at least West Africa zone, we are still in front, but I know we can do better. And that's our target because we are aiming at the best cancer centers in the world. We want to be at par with them because we know we can do it. It's doable. And we're on that path at the moment. So
Well,
please go ahead.
let's hope that the government is ready for talks on that or discussions on that particular issue and talking about brain drain. And also, let's hope that they're serious enough to get those equipments that you have actually mentioned in all corners of the country. Now, Mr. Komolafe, it's been a while. Thank you for staying with us.
Thank you.
All right, so
Thank
now
you so
still
much.
talking about, timely intervention, Mr. Komolafe. Now, how effective are current screening programs in preventing cancer progression and also mortality? I think I read somewhere where AI is actually doing a good job, or I don't know if it has been launched or it will be launched, where AI will be able to detect cancer tumors years before it even comes out, years before it is out. So can you tell us how AI in some parts of the world is actually transforming cancer diagnosis?
All right, thank you very much. That's a welcome development, but the fact still remains that AI cannot replace humans' treatment or professional medical doctors for many reasons. And even sometimes you engage some of these. There was this AI tool that was built recently, and after the recommendation, it still left a note below and says you still need to see medical practitioners to know your options. Because sometimes when you're being diagnosed, when a patient is being diagnosed of this cancer, there is also, for the patient to get treated, the patient also needs to qualify for deep treatment, either immunotherapy, like Dr. rightly mentioned, chemotherapy, radiation therapy. The patient still needs to qualify for it. The person's heart needs to be strong, and many other things that are also in place. We've had patients reach out to us and share this information with us and how things have been like that. So AI cannot 100% replace the place of medical professionals in this. And during the COVID-19, we see telemedicine being in place. You see the telemed interacting with patients, online in US and in Europe and in all of these countries. So it is a welcome development because all means to get prevention in place is also part of the treatment. We have clinical trials, and we know that AI cannot be involved in clinical trials. Most of the treatment, like Dr. Yakubu mentioned, is talking about orthodox treatment and the traditional treatment. You see that not the orthodox treatment is well undergone clinical trials, and it has been tested, proven over time again. So you have AI as part of the prevention measure, and to make the job of a medical professional quite easy. But it cannot replace it cannot replace the human professional in the medical space. And one other ways whereby we can better improve prevention and also treatment is to ensure that like I mentioned earlier, brain drain. We have doctors leaving the countries, and recently we have patients from UK coming back to Nigeria for treatment here, because of the cost of treatment over there. They come back here for treatment. When you go back there, you see a Nigerian getting you treated there. So we must find a way of ensuring that the best hands we have in Nigeria do not leave. And one of the ways is to encourage them. Why they leave is because of finance, remuneration, care, and a whole lot of things like that, which the government is really doing a good job to ensure that there's an improved state in medical practitioner welfare. So if we have that, that would be a very good one. And if we can also have a means whereby what I'm now aware of is if we have pharmaceutical companies in Nigeria who has clinical trial or developing this cancer treatment, that would also be a welcome development to have patients, who survivors who want to be part of such clinical trials to get the cure for certain cancers like colorectal cancer, cervical cancer, and the rest. So that would be because over time, we realize that survivors do not like to be part of clinical trials because there is a mindset that that is being in place. I don't want to be a guinea pig. I don't want to be a test experiment and the rest like that. But people also need to be aware that this Panadol extra being used today for painkillers and the rest also undergo clinical trials as well. We have in the US, a lot of companies in the US are having clinical trials, calling African American and African to be part of these clinical trials. And a lot of people really wouldn't want to be part of it, even if it's to actually lead a cure. But this is also another issue entirely. But
Hello, Mr. Komalafe. All right, we seem to have lost him there, but I'm sure he'll join us back. Let's come back to you, Dr. Yakub Habibu, and let's quickly talk about nutrition and lifestyle, okay? Now, earlier you talked about, living healthy, being as one of the advantages of living cancer-free. Now, what evidence links specific dietary patterns, physical activity levels, and also lifestyle choices to cancer risk reduction or prevention?
Thank you. There are several research has shown that refined food with high residue, junk food, fatty food are linked to several forms of cancer, from colorectal cancer, breast cancer, and various other type of cancers. While our own indigenous food, which are low residue or high fiber diets like the beans, yam, and our own traditional, they protect against this type of cancers. And also exercise, regular exercise boosts immunity, and they also help us to prevent, or reduce the risk of cancer. And we know that our forefathers were not sedentary. They were either farmers, hunters, and by their activity, they do exercise, every day. And this helped to suppress, the incidence of cancer. And also, if today you will say that our females, they reach puberty at a very early age as compared to our parents that reached puberty at a later age. Today, you see a 9-year-old girl that's already menstruating. Meanwhile, our grandparents, they menstruated around 16, 18. All these
times are changing.
Also, yes, these are lifestyle changes that I said that are prone to that result in increased risk to cancer. And these are lifestyle that are shifting towards that of the West. Like most of us now are sedentary in our activity, whether be you a doctor or even those in the shops, you sit down most of the time. People want to, sit down and make life, as easy as possible. We even use remote control, use washing machine. We don't wash anymore, so all this activity increases the risk of having cancer.
Okay, thank you so much for that. Now, Professor, he talked about living a sedentary lifestyle as one of the major issues and major causes. Now, what about mental health? How do psychological factors, such as stress and anxiety, impact cancer patients, quality of life?
Well, that's quite interesting. Like anything in life, if you are filled with so much stress, you just are such a confused person that might not even know what you are doing. And that means now perhaps might not be eating the right food, might not be exercising, do right exercises like Dr. Abib just said. Your lifestyle might be so carefree. For instance, if one is a woman, you think, going to start having several multiple sexual partners, which exposes you to risk from HPV virus and the risk of cancer, and all sorts of things. So I think that aspect is quite important in itself.
Well, what about the where we found ourselves in Nigeria now, talking about the lack of finances, you know, and the fact that things are difficult for people living in Nigeria at the moment, and it increases, you know, the whole stress levels and everything.
Well, that's important. One thing we must remember is, and which we don't want to accept, we must remember that cancer is not a cheap illness to treat.
Yeah.
Can be very expensive, and you need all the support, both from the government, from the family, and other individuals who can support. But we take things for granted. You think everything is free. And then because you think things are free, you don't pay the proper services rendered. And that means because they don't get the money, the hospitals cannot even repair faulty machines, or they cannot buy the drugs that is required, or a patient requires a specific type of drug, you cannot get the drug because you cannot afford it. All these things, they go round, you know, it's a clockwise sort of circle. And they ultimately affect the quality and of treatment that we give our patients. So it's important for us to still get our government involved, to let the government realize that, look, you cannot leave this aspect to the individual alone. It's not a cheap thing.
Yeah,
I mean,
definitely.
it is expensive.
Okay. All right,
a single drug, for instance, costs over *1 million naira.
Oh, wow.
You know, and we have to get that injection maybe once every 3 weeks for about 4 to 6 times.
Not
and
to
one
talk
of
of
the drugs that
chemotherapy.
you know, for *1 million naira, yes, only that's only one. Well, who can afford that in this day and age in
Not
Nigeria?
to talk of
Let's be realistic.
chemotherapy.
Yes, you know, I'm talking about that. And there are a lot of other things too. Even another thing we do here, even our radiotherapy costs money. Because these things cost, and because it costs money, we have to be able to afford them. Otherwise, the patient cannot get the best possible. And if you don't get your treatment complete, in fact, there's what we call a rebound. For instance, if I'm treating a patient over a 3-week period, and then halfway through the machine breaks down, or the patient cannot afford to pay for it again, or there's something, and then there's a lapse in the treatment, that cancer can now come back with even stronger force and do more damage to the patient than would have been otherwise.
Yeah.
Yes, you know, so all this, we need to take them into consideration, and we need to educate members of the public. We need to get the government to come in and support this. And I'm glad that they are now allocating some funds for treating cancer. But, you know, at least under the health insurance scheme, we know that there's cancer fund, you know, that is being given now. But even at that, this is a little drop in the ocean. It's still, it's still, I like the spirit, but, you know, we are not doing enough. And people are suffering from that aspect.
Okay, Professor. We're actually about wrapping up now, but let's quickly hear from Dr. Habib Yakub on stigma. That's just in 1 minute. If you can tell us, you know, how we can, you know, effectively combat cancer stigma, you know, and promote societal understanding and also empathy, which is very important.
Yes, cancer stigma is still there, although it's not as immense as it used to be. To combat it, we need survivors to come out. We need to put them in programs. They should come out and speak to the populace, especially if we have celebrities that are survivors. They need to come out. And with that, stigma will be suppressed if they can come out and speak. We have quite a number of celebrities and government officials, politicians, well-known people that are survivors. Only if they can speak out, and people will see that people do survive from cancer treatment.
Well, this is a message for so many people out there who are silently, you know, going through and treating cancer alone with the fear of being judged. Well, thank you so much, Dr. Mohammed Yakub Habibu, Head Radiotherapy Department of NSIA, Luth Cancer Center, for joining us. We also had Professor Abayomi Duro Simieti, Professor of Radiation Therapy and Oncology, UNILAG, And we also had Jesu Tommy Akomolafe, Communication and Health Advocacy Manager, Trials of Color. We appreciate you for your time, gentlemen.
Thank you.
Thank you.
And with that, we've come to the end of one slot. Thank you so much for tuning in. I'm Darshan Usman. Have a wonderful evening.